So it's my honor to introduce Martin Celaya, Bureau Chief of the Bureau of Assessment and Evaluation with the Arizona Department of Health Services. In his role, Martin provides leadership oversight for all maternal and child health, chronic disease, injury, and violence evaluation and epidemiological efforts for the Arizona Department of Health Services. Martin has over 15 years of work experience in local, state, federal, and academic public health, and has worked as a federal assignee with the U.S. Centers for Disease Control and Prevention, the CDC, on HIV, STD prevention, global program evaluation, Ebola and Zika prevention efforts in the United States, and enteric disease surveillance, among other areas of national importance. He is the principal investigator for the Eliminate Maternal Mortality, the Arizona Sudden Unexpected Infant Death Registry, Sustainable Systems Development Initiative, and the Advancing Violence Epidemiology in Real-Time Projects in Arizona. Martin, buenos dias, welcome.
Buenos dias, Patricia, and buenos dias, everybody. Good morning and welcome back. We are very excited to be moving forward into day 2 of the Maternal and Infant Mortality Summit, and hope everyone is ready for another full and informative day. I definitely have my venti cold brew ready to go for today. And for folks that have been attending these summits in the past few years, you know that it wouldn't be a summit without a few corny jokes to start off our second day. So I do have a few corny jokes that I brought for my opening here. And so if folks want to guess what the response to these jokes are in the chat, please be my guest. So for my first joke, I forgot to say also, besides my name, Martin Celaya, I am also a very proud a resident of San Luis, Arizona, which is in Yuma County by the US-Mexico border. So if there's anyone here from Yuma County or San Luis, do a high five to you virtually. Okay, so for the first joke is, why is Peter Pan always flying? Why is Peter Pan always flying? See, we get, oh, I see probably a cousin. I see another Celaya. Hi, Celia. We're gonna have to get connected afterwards. Why is Peter Pan always flying? Yeah, Stacy, because he never lands. You got it. All right, next joke. How does Darth Vader like his toast? How does Darth Vader like his toast? I know we got some Star Wars fans for sure. On the dark side. Yep, Deborah got it. On the dark side. You guys are good. You guys are awake this morning. Why won't Apple start making cars? Why won't Apple start making cars? All right. Quien sabe? Apple won't start making cars because they don't support Windows. And then my last one for this morning, and I'll probably throw some in later at the end of the day, is what do you call a boomerang that doesn't come back? What do you call a boomerang that doesn't come back? Yeah, Taylor. Taylor got it. The stick. All right. Thanks for, hopefully that brought a little levity to your morning today. Next slide, please. We're going to transition over into our land acknowledgement. So just like we did yesterday, and I welcome you all to do your own land acknowledgement there in the chat. Acknowledgement is a simple and powerful way of showing respect. It is a step toward correcting the stories and practices that erase Indigenous peoples' history, culture, and language. It is a move towards inviting and honoring the truth. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort by acknowledging what has been buried by honoring the truth. Next slide. Every community owes its existence to the vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Let us all take a moment to acknowledge the ancestral homelands of the tribes in Arizona and of the tribes where you are coming to us from. Today, I'm speaking to you from the Phoenix area and would like to recognize the Otam and Pipash people who have stewarded this land since time immemorial. We pay respect to their elders, past and present. We're grateful and appreciative to those whose territory we reside and work on today. Thank you. We are fortunate to have with us this morning Mr. Delton Francis to share an opening blessing as we move into day 2 of the summit. Delton is a member of the Navajo Nation and is a prevention specialist with the Navajo Nation Department of Behavioral Mental Health Services in the Kaiveto Outpatient Treatment Center with over 10 years of experience and is continuing his education with Diné College. In 2022, Delton received the First Things First Navajo Nation Region Champion for Young Children. The award is given to local champions who actively volunteer their time to raise public awareness of the importance of early childhood development and health. Welcome, Delton.
Good morning, Martin. Thank you for that introduction. Again, I always feel humbled about that award, just because I know there's many other people that I think strongly deserve it more than me, because they go above and beyond in their everyday work. And I feel like I just played a smidge part in assisting with delivery of services and stuff like that on volunteering my time. So there are hundreds of people out there that go above and beyond every day in their daily work or even volunteer. So from myself to everybody out there that volunteers and does work, after hours, I commend you too as well. So good morning, everybody. It's good to see or partially see everybody. I just see names up here. And I want to thank the ASL interpreter. I do have a niece that's hearing impaired, so I want to say thank you to everybody that knows some ASL and talk. So although yate been done traditionally, and I'm gonna go back and forth between the Navajo language, Diné language, and English. So this morning I was given the opportunity to open the circle, as it's called here on the summit, and so to those of you that may possibly understand the Navajo language, I will do a majority of the blessing in Navajo in my Diné language, and I'll just provide a brief description maybe before I go or after. So again, I know this subject here today is about, the different subjects that you guys discuss about pregnancy and children. So with that in mind, I'm going to concentrate my prayers on that and the education that's being brought here. And I want to commemorate everybody that's in this field and helping families out there. So I will go ahead and open the circle this morning verbally with a prayer and blessing to everybody here this morning. So majority of my prayer will be in Navajo. So I'll go ahead and start. So Kode hajondole nahastan shema yadashit shita hayos kaf nohodit ish nohol tsui shahashye sisna jina so zil dog osli the benza zil nahotisli chon in shiche hashje shiche hashjewan yoska istan shema istanat lay shema na dot the guy ski no deal tsui at eight na dot tsui at yodel tas a is the tas a to hashchin to biage to the dean ski and ani at satna a big hojon all condition la de so the zambana stitole hode stin strandini die kun sani dos tui na has tranigi ich habe das da in dole to ich habe jetzt dole Arolan lay bamasan bitshe balchin gilhaje lini sababinash ni dole Arola dikun lay hade shin ki masan ki chain ki nalikadan ki naladan lira hade shin de do hadis they don't know what you could day dish change it no stop a cotton de kaygi belash la lini danitle aro benache what are you at الكائنات تو أهلنا بانسا كيسو هدي ناسو نانش بديل أنا ناديج بايت إجيدو بهن إجيشي لي ستايل ساتو أوي إتشيجشي بهن دوشي بهو أعتقد آشي بتسيستا هيت آدا بجي نهوت إوتا إيشي بايد أتيدو إيشي بناتش نجنو يأتيها أهو أعطو بناششين تنبه بكا اتجهتو له جن لي آيسيان باهستين لي استا الصادون لي نوچ استا الشينجه آج أهول جشي بان أباهستك دو خطيين لهتن سو إيشي بناتش دي كون بين دا بي سو دزنبه إيش لارو له آدون لي سو بايد أوتي أشي دشي نانيل آزدون جناشي الچن دالني So ei hot arbet pop så dessen då lät och det någonstans baka de allt vad hinna nitle allt vad de kom patient så kesi bi en del kinigi allt vad de nada nitle då belash la nita nitle och hot och don jana halana benach då kashin så be nasna och dato le hashit ashike då hot så dessen shi be hasti då le och det shi sponsor kies to sta hot anjana o ittili inani o tilliki be bohalni to benach shi at nas be na o tatole ot to the zembe hasti to le de stin stran lini tron na de jonas dole de hiket aton si tache tron de ku na si tranigi de jonas dole de stin stran lini jonas. So I want to thank you everybody for listening, and I understand that my introduction. I do live in Page, Arizona, but I do work in Kaibito, and then originally from Chonalia, Le it means two rocks standing. So that's where I'm from, and Adon Shlinigi Ed Shlon. So those are my clans, and through the prayers that I just now recently stated for everybody here in this conference room, I just remembered everybody's ancestral background. I remembered everybody's maternal and paternal grandparents, and I remembered everybody's siblings and blessed their siblings and all your siblings' kids. So basically, just blessing everybody here today with your ancestral background, where you're coming from, and having the respect to be here to discuss the importances of paternal health. So that's what I encompass in this morning's prayer, and talked about how important it is to help one another, and that we are all the balash lani. And that's one thing my grandfather told me, was that coming into this field of behavioral health, he told me I need to see the person as a human being. And it was unto my understanding, he said, we're all balash lani, which means the five-fingered beings. So to my understanding is that, everybody needs help at some point in their life. And it just so happens that today's subject is about maternal health. And in traditional Navajo way, the women is held very sacred. The women is a matriarchal society, so that even women have strong, powerful existence within our culture and our language. And even the beginning of our stories originate around women too, as well. And they were the ones that bore, two strong twins that took on the different disparities that took on the earth. So we hold women in high regard and hold them in a holistic level, especially when they're pregnant. It is said that it's a holy time when a woman is pregnant, from the time of conception to the time when the new person is born into this world. And when this person is born into this world, this child, they already have they're already a grandfather, they're already a grandmother, they're already a parent, they're already a mother, a father, they're already an aunt, they're already an uncle, they're already somebody's brother and sister. And by saying that, I'm referencing our clanship and our what I mean by that is, when a child is born, they are born with 4 clans. And with that 4 clans, we are never alone, that we will always have a relative out there somewhere in the world. So that we're never alone, and that I was always told by my grandfather, and he was a medicine person for most of his life. And those are some of the teachings that he taught me, and I try my best to continue that everywhere I go. So with that being the case, I want to thank everybody's time for having my time to express my gratitude and my prayers for you all. And I want to thank you all for this morning's this chance to bring you some information and a prayer for you guys. I wish you guys all a blessed day, and I hope you guys have fun learning new stuff, and have a great day and have a great morning. Yeah.
And thank you, Dalton, for sharing and guiding us through that opening blessing. I just want to recognize that you're getting a lot of gratitude in the chat there for your kind words, your presence, and your time. So we appreciate you. Thank you very much. I'd like to start with just doing a quick reflection on what we learned yesterday. I don't want to take too much time so that we can hear from Dr. Borders on her initiatives there at the Illinois Perinatal Quality Collaborative. But as you all remember from yesterday, we had a great presentation from Leslie, where we learned about the various gaps and opportunities to support and expand the birth workforce, including community health representatives, community health workers, doulas as such, in the clinical setting, and further integrate these professions into the system of care. We also heard from Aubrey and Karen from Arizona Department of Health Services on the latest data regarding maternal and infant mortality. We had national and state level experts, Joy, the March-Dines, and Zeta, who shared information on the importance of policy, program, and stakeholder engagement. We had excellent presentations on addressing gaps and needs of Native American women in healthcare deserts, and how private insurance and Medicaid are implementing strategies to improve coverage, access, and support to expand the workforce. As we close out day one, we had a look at Arizona birth workforce models in action that include the role of a Navajo doula and what one university is doing to expand midwifery in Arizona. These are only a few examples of what is occurring in Arizona. Next slide. I won't spend too much on this one. I just wanted to, again, remind you all where you can find the latest information for maternal health and child fatality. If you do have a smartphone with you, you can take a quick snapshot or scan those QR codes there, and it will take you right there straight to the report. I know some individuals had questions about COVID-19 and whether that could be contributing to the rise in infant and maternal mortality. And so I'd like to just point you to that resource there. There on the maternal health reports, there is infographic, excuse me, on COVID-19 and Arizona maternal deaths for folks to reference as well. Next slide. Today we have, again, a full agenda that will focus on optimizing maternal and infant care. Today's sessions will include a keynote presentation by Dr. Ann Borders with the Illinois Perinatal Quality Collaborative. We will hear about Arizona maternal health initiatives that are statewide, bringing about systems change, support for clinicians aimed to improve health outcomes for women and birthing persons. What and where are gaps and opportunities to enhance and improve during pre and postpartum care? We will also learn about the Arizona High-Risk Perinatal Program and a new evidence-based home visiting model that came to Arizona. Local experts will highlight various perinatal infant care models and initiatives. And to close this dynamic day, my colleague and I, Laura Luna Vellucci, will introduce and launch the Arizona Fetal Infant Mortality Action Plan.